Surgery is constantly changing, and advances in technology are rapid and complex. As a result of these innovations, today's residents may not be exposed to certain procedures. In addition, residency programs continue to cut back on hours of practice, meaning many residents enter their fellowships with less experience than their past colleagues. Now more than ever, residents need a new way to progress, learn, and transfer surgical skills into clinical practice. At OSSimTech, our virtual reality simulators combine high-fidelity anatomy and proprietary haptics using authentic surgical instruments and intraoperative guidance in the form of X-ray imaging, effectively replicating the surgical experience. In order to be effective, a surgical simulator must provide a realistic experience. This is why all of the modules present the learner with pathologies, procedures, and techniques designed to increase surgical competence. Powerful haptics allow the user to differentiate between soft tissue and bone by providing realistic signals and a two-way flow of information. New users can begin with tool handling to familiarize themselves with the simulated surgical instruments and how they function before moving on to more complex and challenging exercises. The idea is to allow the resident to experience increasing levels of surgical complexity to challenge and improve their development without having to practice on patients. In the spine module, learners can practice spinal fusion and decompression techniques and use appropriate surgical tools. Practicing surgical techniques like pedicle screw insertion and trajectories, interbody spacers, and plate and screw fixation can be perfected outside the surgical suite. Performance is measured objectively, and learners and their tutors can track their progress over time. Our simulators follow established board guidelines, and we can help you easily incorporate our programs into your current curriculum. Our high-fidelity simulators provide an on-demand, realistic experience to gain psychomotor skills and spatial awareness in an environment that is risk-free to the patient. It is available 24 hours a day, 7 days a week in a safe and fun environment, while preparing the user for today's advanced surgical procedures. After all, practice makes perfect.